Bismillah ar-Rahman ar-Rahim. Let's start. I'm Dr. Ali Jaratli, and we're going to talk today about anxiety, and hopefully we will learn something about anxiety and understand the mechanism and the treatment for anxiety. So general anxiety disorder is very, very common illness. It's one of the most common illness in the world. So in the US, about 7% of the population have anxiety currently, and I think with Corona is much, much higher now. As you know, most of anxiety are more common in women than in men, and most of the anxiety which is in women are caused by men, as you know. I'm just kidding here. So anxiety run in the family. The reason why women had more anxiety is because women live more in poverty and they are subject to discrimination and abuse. I think this figure is not updated. This is an old figure, but I think it's much, much higher now. And most of the people are in the primary care clinic suffer from anxiety. Anxiety usually has many, many reasons, including genetic factors. So if you have the gene for anxiety, then you're going to have anxiety. It's the family dynamic, is the brain chemistry, is the social influence, the lifestyle, like when you have a divorce or have family issues or lack of family support, usually cause you to be more anxious. So it's multifactorial. It's always the gene and the environment. So you have the gene for anxiety, and then you add to that the environmental factor. Anxiety also related to childhood. So if you have very difficult childhood, then you might likely to be anxious later on. The main neurotransmitter we talk about in anxiety is called GABA. And I know you know a lot about GABA, so I'm not going to spend a lot of time on it. Let's see, Salma is taking an exam. So in order for her to pass the exam, she needs to tune up her brain. So there is a place in the brainstem called locus coeruleus. It's deep in the brainstem. That locus coeruleus is a group of neurons that secrete something called norepinephrine. Norepinephrine is secreted from the locus coeruleus like this. So in the beginning, let's see, you are sitting here on your table, and now your norepinephrine will be secreted like this. So the locus coeruleus will put like a pulse of norepinephrine to keep you alert and awake. In anxiety and panic, it will be like this. So the locus coeruleus put a lot of norepinephrine in the brain, and the brain is not equipped to handle all of these norepinephrine. So the patient feels tired, and they tell you that I feel like I was run by a train after they have panic or anxiety attack. So norepinephrine's role is to keep us alert. If we don't have norepinephrine, we'll be slow and sluggish and sleepy. Norepinephrine is one of the neurotransmitters that awake the brain, make you alert so you can pass your exam. The problem with anxious patient is usually after they pass the exam, normal people will slow the norepinephrine, but anxious people, the norepinephrine keep on all the time, and that's what we call anxiety. So norepinephrine is what keep us alive and functioning, but too much of norepinephrine make us anxious and panicky. So anxiety is an alarm system to teach us that there is something important like exam or a lion chasing us or a bear or dinosaur chasing us. So anxiety comes from the flight or fight response. Fight or flight response, when you are chased by a lion or a tiger, then you have two choices, either you fight or flight. Of course, most of you like me will fly from that, and we don't like to fight any tiger or any dinosaur or any lion. So in order for you to fight or flight, you need to bump up your norepinephrine. The part of the brain that is responsible for that is the amygdala. The amygdala would start the danger that there is something dangerous, there is a lion chasing us, and then the amygdala will put you in a state of fight or flight, which is same symptom of anxiety. So anxiety symptom, if you want to learn it, just imagine that you are that zebra who is chased by that lion. So the alarm system that the amygdala starts is called fight or flight, and it's very important survival mechanism. If our grandparents did not have the system, we would have been eaten a long time ago, and we will not be able to be on Earth since that time. So the problem is, as we told you, we don't have any lion or tigers right now, but we're still very anxious. We still use the same system. So we use it for, as we mentioned in the last session, if somebody said bad thing to us, or if we have any nasty news or bad news or anything. So this line can be anything from financial problem, COVID-19, or any social hardship. We can always use the system which called fight or flight for a reason that is not was meant to be. So the problem is when we have a lion chasing us, the amygdala and the locus coeruleus take notice. This is my grandfather running from that lion. So what happened with him is the locus coeruleus and the amygdala is the one that start the fight or flight, where we bump a lot of norepinephrine in the brain. And we said that locus coeruleus is the part of the brain that secrete norepinephrine. And that norepinephrine is usually secreted normally to keep us alert and awake and function. The problem with panic attack and anxiety, we secrete a lot more norepinephrine than normal. So we feel tense, we feel sweaty, we have back pain, we have muscle pain, we have heart racing, we feel like we are about to suffocate. Why? All of this is a symptom of increased norepinephrine. So this heart palpitation, delayed pupil, high blood pressure, rapid heartbeat, all of this is sign of being chased by a lion or being chased by exam or anything similar to that. And you are having anxiety and panic attack. So this is the HPE axis that we mentioned last time. The amygdala sends the message to the hypothalamus, and the locus coeruleus would secrete the ACTH, and we secrete a lot of these norepinephrine and cortisone. The problem with these cortisone and norepinephrine, once we secrete way too much of them, it's not good for your body in the long term. Why? Because when you have too much norepinephrine, your heart will keep pumping up and you will have high blood pressure. When you have high cortisone, then you're going to have high blood sugar. So all of these patients who had a lot of stress in early life ended up after 10 or 20 years having diabetes and hypertension. Why? Because they kept that system alive without being able to tone it down after the danger is gone. So this is what happened. When we face any stress in our life, we start our HPE axis, we have way too much norepinephrine, way too much cortisone. Few years later, we end up having diabetes and hypertension. And this is what we see in the HPE axis. Look at here, see the brain when it secretes too much CRH or CRF, which is the hormone that secretes ACTH. ACTH tell the adrenal gland to secrete more cortisone. We ended up having severe anxiety. So most of the patients with anxiety and depression have way too much CRF and way too much ACTH than normal. Why? Because they are very anxious. And we notice it in most of the patients with anxiety and depression. Let's see, this is the son who is taking an exam. The son who is taking the exam is going to activate his locus coeruleus so he can pass the exam. Locus coeruleus will secrete a lot of norepinephrine. Same locus coeruleus that make the great-grandfather run from the lion is the same a gland called locus coeruleus that secrete norepinephrine, the same one in the son who take the exam, and the same one in the great-grandfather who was running from the lion. Both of them do the same thing. They increase the norepinephrine secretion. What happens when we have way too much norepinephrine? We have increase in heart rate. That's why the patient will feel suffocated and we feel his heart is pounding. We also have muscle skeleton pain because you need to jump and run from that lion. So your muscles will be contracted and you will be ready to leave. So you have most of the patients with anxiety have back pain or muscle pain. This is part of anxiety because you need to be running away from that bear or lion. Your blood pressure in the arteries increase, so your heart can pump too much blood to get out of the system, and your blood sugar increase because your cortisol level increase to get some energy to the muscle, so you can run out from that bear and that lion. So this is the same symptom of anxiety, is the same symptom of having high norepinephrine. So if you understand this physiology, it's very easy for you to understand the anxiety. Is the same system that our grandparents used to use to run away from the tigers and lions. Is the same system we are using now to pass our exam and feel normal. So anxiety is a normal reaction. It's a way to alarm you that there is something dangerous, and it's a way to keep us alive, because if our grandparents did not have this alarm system, they would have been eaten by lion and snake long time ago. So anxiety is a normal feeling that your body will produce during dangerous. The problem with us, there is a book for one called Stephen Soplaski. Soplaski said that zebra is much smarter than a human being. Why? Because the zebra, imagine if you are a zebra and you are chased by a lion. 10 minutes is over. You are either a lunch in the lion, and you are enjoying, and you taste delicious, and you are fine, and you are happy inside the lion's tummy, and you save the lion from starving, and the lion is happy and you are happy. Or you are able to escape, and then you are sitting in Starbucks drinking your mocha and cappuccino and you know, the cake, all the cake you want with the nuts and everything around it. So 10 minutes, it's over. You are either a lunch or a free to eat your cake. However, a human being is not as smart as the zebra. So if we have activated that HPA axis, it will keep on for a long time. We don't have the switch off like the zebra. The zebra will switch that HPA axis and live normally. Human being, when we get mad, when we get anxious, we keep that HPA axis on. We don't have the ability to switch it off. And as we said, these hormones, especially the norepinephrine, the cortisol, are not supposed to last this high for a long time. If you keep it high for a long time, you're going to subject yourself to a lot of illness, including diabetes and hypertension, and a lot of immune disease later on. So we are living in a society where chronic anxiety is the normal. We have to worry about everything now, especially with the economic situation.
Doctor?
Yes.
Oh, do you mind ask a question?
Yes.
Yes. Why the anxiety and depression and on inflammatory disease like diabetes?
It's coming in the next couple of slides.
Yeah, thank you so much.
So chronic anxiety is unrealistic and excessive and is very uncomfortable, but we don't consider it pathological unless it's really interfering with daily life. So it's okay to feel anxious to pass an exam. It's okay to feel anxious when you travel. It's okay to feel anxious when you have financial difficulties. But when this anxiety interferes with your life, where you are not sleeping and having social problem and becoming angry with people, then it is not normal and you need to seek treatment. So here, when we consider anxiety pathological or abnormal, three things. This always come in the exam. Interfere with daily life. So it's interfering with daily life, then it's pathological. Like there is time where you cannot sleep and you cannot go back to work the next day, or you feel suffocated, that you are having panic attack and going to the ER, or you have it for a long time. So you pass the exam and you're still anxious few weeks after the exam, and you cannot control it. So the difference between worry and anxiety: worry is a normal thing you can control. Anxiety or general anxiety, it's when you cannot control it and you cannot turn it down. So this is the difference between worries. Worries is about specific things, like you have an exam and you know that Dr. Yaqinuddin is after you, so you worry a little bit and you become anxious a little bit, so you pass the exam. But anxiety is constant and chronic, and it's never down, and you cannot decrease it, and it's interfering with your social activities. So the worry and anxiety you cannot control, worry you always can control, and it's you know, it's unpleasant, but you cannot, you know, it doesn't cause you a lot of social impairment or social distress. While anxiety is really, when you see anxious patients like we see in the clinic, it's really destroying their life. They cannot function, they cannot go to work, they don't pass any exam, they fail in life, and they have a lot of social problem related to their anxiety because they make people around them overwhelmed and anxious. So anxiety and fear, what is the difference between fear and anxiety? Fear is when you have a fear of certain things. So if you take me to Burj Khalifa and get me a ticket to go to the top, I will have a fear, I will have a panic attack. But if I am on the ground, I'm fine. This is a fear, not anxiety. Anxiety is coming from within, while fear is coming when you see a needle, or when you go to the plane, when you're gonna see a snake or a lion, then you have fear. It's not anxiety. But now a human being have something is good and bad called the frontal lobe or the prefrontal cortex. So the prefrontal cortex has the ability to predict the future. So if I am a medical student and I have a good frontal lobe predicting that my future will be good or bad, if my frontal lobe told me that your future will be bad and not going to find a residency or job, then it will produce fear and anxiety. So that's why anxiety is a price we pay for having a prefrontal cortex. And this is the problem because our frontal lobe can anticipate the future. So we call that realistic anxiety about the future. So the difference between anxiety and fear, always anxiety is related to future oriented. It has a lot of somatic complaint. You cannot even control and you cannot predict at some time. While fear only happens when you have certain situation, like you are in a plane or in Burj Khalifa or you see a snake, you activate your alarm system. And then once that's gone, then you become normal. And then panic attack happen when you see something, like for example, when you see something dangerous, you will have a panic attack. If somebody told you that you fail exams, sometimes you have a panic attack. This is called acute panic attack, which is caused by one reason. But the problem with panic attack, as we're going to see later on, they come suddenly out of the sudden without any threat outside. So that's what you call real panic attack. We're going to talk about them in the next hour, inshallah. So as we said, we have two kinds of anxiety: realistic anxiety, which is feeling anxious about real danger, like having a physical problem or being in a car crash or animal. And then you have the neurotic anxiety, which is done by our frontal lobe, which kind of internal conflict when the frontal lobe tells us that I'm not going to be able to find a wife or a job, or you know, my future is bleak, then I will have anxiety. Is the imagination of my frontal lobe, which was able to predict the future. So what is the symptom of anxiety? The main symptom of anxiety is the patient live in what we call besieged under thought of anger and anxiety, where he had worry. Do I have enough money? Is my health going to be okay? Is my physical insurance going to be okay? Is my future of my kids going to be okay? These thoughts which come to your mind, you cannot really control it. So the patient will tell you, I have a lot of thought coming to my mind, but I have no ability to get rid of these thoughts. So they have exaggerated feeling of response. So anxious patient usually, as we say in Arabic, make a mountain from a molehill. So always exaggerate things. So if you hear bad news, it's always very, very bad. If you hear good news, it's not that good. If he had small pain in his abdomen, he will panic and feel like he's having cancer. So they always tend to exaggerate that feeling. This is what you call anxiety. So these patients who had general anxiety, they really have very poor quality of life. Why? Because they keep moving from one stress to the other and always keep predicting what's going to happen in the future, and they always look in a very bad way to the future. So the symptom is really like you are chased by that lion. In order for you to escape from the lion, the locus coeruleus will pump a lot of norepinephrine in your brain. So when we have too much norepinephrine, as you know, norepinephrine makes us alert, so we cannot sleep. So the most common problem with anxiety patient will come and tell you, doctor, I cannot go to sleep. I have a sleeping problem. That's mean you have way too much norepinephrine. You feel irritable, like you cannot relax. You are sweating because you have too much norepinephrine. Your GI symptom will be crawling and your abdomen will become having a lot of pain in your colon. You will have heart palpitation, you have a dry mouth, you have muscle tension. All of this happen when you are running out from that hungry lion. And as we said, you taste very delicious for him. So, and you have the psychic symptom of anxiety where you worry a lot, you cannot concentrate, and you're concerned about your health. Also, after this, after the brain get this way too much norepinephrine, you feel like you are run by a train. So the patient will tell you, I feel tired. I feel like I was really hit by a train and I want to just sit and relax and sleep. This is all after the norepinephrine goes down. So you are worried and you cannot sleep. You stay until 2, 3 o'clock in the morning and you cannot go to sleep. Trouble falling asleep and trouble staying asleep. You have this thought which is intruding to your brain that you cannot control it, and you have this racing thought, thinking about the future, your job, your exams, and your health. So this is the main symptom: irritability, feeling tense. Like a lot of the patient will tell you, the exact word, and you hear it in your clinic, is the patient tell, I feel tense. The patient, I feel mashdood. Mashdood means tense. I'm always on the edge. And you feel inadequate. Why? Because you cannot accomplish anything. You cannot concentrate. Why you cannot concentrate? We said, they mentioned in the last session, remember, the frontal lobe is the thinking part of the brain. And when we have anxiety, anxiety usually comes from the emotional part of the brain. So the emotional part tell you that there is a dangerous situation. And when that's happened, the emotional part of the brain hijack your thinking brain and you cannot think at all. Why? Because now your thinking brain is under the control of your emotional fear, and now it's always under that control. You cannot think or produce anything. That's why anxious patient usually, we said, fail in the exam. You see students who are top-notch student, A+, they go to the exam and they fail. Why? Because they have a fear during the exam. That fear means that thinking part of the brain and the front of the brain will become obsolete. It will be hijacked by the emotional brain and you cannot make it work, and you fail in the exam because the patient will tell you, I feel like stuck. Stuck means I cannot think, I cannot make any decision. Please help me understand what's going on. This is the typical symptom of anxiety. Then you have the back pain, you said, and the GI, because your GI symptom is very connected with the brain. So anything happen in the brain will manifest in your abdomen. So a lot of these patients will have what we call diarrhea, spastic colon. You know, most of the patients with anxiety are usually go to the GI doctor complaining of IBS, irritable bowel syndrome. Why? Because the place in the brain called the insula is connected with the colon. And in any high emotion, they send a lot of secretion to the colon, and you have all of these diarrhea and constipation and abdominal pain. So IBS, although it's treated by the GI doctor, it's really a psychiatric problem, is related to severe anxiety. That's why most of the medication which work for anxiety works for IBS. So when you go to the patient with IBS or irritable bowel syndrome, the first treatment they give him is antidepressant and anti-anxiety. Why? Because it's coming from the head up, which is making a lot of contraction in the GI system. There is difference between anxiety and depression. So usually, now the problem is most patients will have combination of anxiety and depression at the same time. But in GAD, general anxiety, the patient will tell you, I try to go to sleep, but I have hard time going to sleep. Once they sleep, they might sleep okay. The depressed patient, they can go to sleep easily, but they wake up in the middle of the night and they cannot go back to sleep. So this is a way to differentiate between depression and anxiety. Now, most patients will have both. They have trouble going to sleep and trouble staying asleep. So this is we call anxiety and depression. But if the patient have purely problem with just going to sleep, then it's more likely GAD. If he has pure problem just staying asleep, then it's more likely depression. And we said the main problem with anxiety is really, remember this, uncertainty. You're gonna get tired of me telling you about uncertainty. Uncertainty is what makes us anxious. When you are uncertain about your future, your residency, you're finding a job, your place of living. So this is uncertainty. Uncertainty, amygdala doesn't like uncertainty. It will make your life miserable if there is uncertainty. And ask all of your family, if you have a family member who are here, and ask your dad and your mom, what is making you anxious? Then most of them will tell you, because we don't know what's going to happen later on. We are uncertain, especially if you are living here and you are not from here. So if you are not living in your homeland, in your home country, where you are here on temporary basis, this is what makes a lot of people uncertain, and that's what causes severe anxiety. So as we know, we use what we call the DSM-5, and DSM-5 tell us that anxiety can be for many reasons. So it's not necessary to be anxiety, just anxiety. Some people who use drugs and stimulants, some people who use a lot of caffeine, and some people who abuse Xanax and all drugs, they can have anxiety, but we don't call that anxiety. We call that substance-induced anxiety. So if you are anxious because you drink 6 Starbucks a day, then it's not anxiety, it's a Starbucks anxiety. If you are anxious because you have problem in your thyroid or cardiac problem or seizure, then this is not general anxiety. This is anxiety related to medical illness. So there's a lot of illness that can cause anxiety, like Cushing syndrome, electrolyte imbalance, pulmonary embolism, pheochromocytoma. All of this can cause anxiety, but this is, we don't call that anxiety, we call it anxiety related to medical problem. But DSM-5 require, you need to learn this by heart, DSM-5 require you to have these symptoms of worries, restlessness, feeling tired, feeling edgy, difficulty concentration, excessive worries for at least 6 months. If you have them for 6 months, then you have anxiety. So this is the DSM-5. I will leave you with the DSM-5 and move on because you can read it on your own. Let's take an example. Joe is a 42 years old married male. So, you know, if he is married, he's going to have anxiety for sure because he's going to worry about his wife and his health and his money. So he said, I am worried, came to the clinic, said, I am worried. Wherever there is anything to worry about, I worry about my money, about my school, about my health. Now, this is not anxiety because all of you have the same thing. Even me have the same worry, money, health, school, everything. But he said, I worry about, anything, you name it, I worry about it. His wife told that he is miserable, he's making life miserable for the wife and the kids. So now we start talking. Difficulty falling asleep. Now it starts to interfere with daily life. We said we don't consider anxiety unless it's interfering with daily life. Here it's interfering with his kids, with his wife, and you don't want to make the wife unhappy. This is the worst thing you can do. So, and difficulty falling asleep. He also said, when I worried, I get tense, I have stomach problem, I have a back pain, I cannot relax, I break up in sweat, I feel tense, and I feel agitated. So here we have physical symptom. If you have this symptom for 6 months, then you have GAD. So here he met the criteria for GAD for 2 reasons. One, it is going on for more than 6 months. Second, it's interfering with daily life. Third, it is affecting his physical symptom and overall quality of life. So a person with GAD have to have excessive worries for at least 50% of the time for more than 6 months. And you have to have physical symptom, and it has to be interfering with daily activity of living. How I can diagnose the patient? First of all, as we said, we need to rule out drug abuse. We need to rule out physical problem. We need to talk out about natural history, like what he is taking, what medication he is taking, because there's a lot of medication for blood pressure or migraine that can cause anxiety. family history. If your mother is anxious, you're going to be anxious. Medical history, all of that. Like, for example, we do blood work to rule out that he had thyroid problem. We do physical exam to see if he had any problem in his heart, like mitral valve relapse can cause anxiety. We do like hypothyroidism. We do all of the blood work to rule out any organic reason. We need to learn and we need to know that a lot of the patients who drink alcohol, they use alcohol to medicate themselves from anxiety. So when you see a patient who is anxious and drinking alcohol, you really don't know whether he is anxious and started drinking to relieve his anxiety, or the alcohol caused him to be anxious. So you don't know which one is the eggs or the chicken. Because if you drink alcohol, that's mean you want to relieve your anxiety. And if you have anxiety, you might medicate yourself by drinking alcohol. And drinking alcohol, if you have alcohol withdrawal, you're going to have anxiety. So always, it's very hard. So that's why we don't diagnose anxiety if the patient is alcoholic. You need to stay away from alcohol for at least 6 months before we figure out, is it real anxiety or it's real alcohol problem. Why alcohol and anxiety are very common? Because alcohol work on GABA like benzodiazepine. You know, benzodiazepine is the treatment for anxiety, and alcohol is work on the same GABA receptor. So alcohol and benzodiazepine both increase the influx of chloride. And you know, chloride is negatively charged ion, so it will make the action potential hard, so it will relieve anxiety because it makes the brain function much less irritability. So both alcohol and benzodiazepine work on the same receptor, which is the GABA receptor. Of course, you need to differentiate it from PTSD, OCD, depression. So all of this we're going to talk about later on in the other anxiety symptom, like social anxiety, is the anxiety that happens when you go in big crowds. Otherwise, you are fine. Panic attack, we're going to talk about in the next session, is a sudden onset of severe anxiety. And social specific phobia is when you see a lion or a snake or a turtle, whatever, or dinosaur, when you get specific phobia against. And agoraphobia is being in a enclosed place where you feel you have panic attack there. Now, let's go to the best part of anxiety. The part I like is what we call the psychodynamic explanation of anxiety. So there's a lot of theories of anxiety. We're going to talk today about the psychodynamic theory. It's a very interesting theory. As you know, the human psyche consists of the id and the superego and the ego. Let's give you an example. This is me, Dr. Ali, and I'm going to eat this piece of chocolate. It tastes good. I cannot stand being away from that piece of chocolate. I want to eat it. It tastes so good. Then the superego said, Ali, you cannot eat this chocolate. You are already fat, and you have diabetes and high cholesterol, so you cannot eat this piece of chocolate. Also, you don't have a neck. If you don't have a neck, that means your head is right over your trunk, and if you don't have a head, you cannot take this chocolate. So there is a struggle between the superego and the id. This struggle between the superego and the id cause you to be anxious. So the theory of anxiety is that we have desire that we are unable to fulfill. Then that makes us anxious. Now, to balance that, we have another part of the psyche called the ego. To decrease our crying and our frustration, the ego come up with a solution. So the ego will come to the id. He said, Ed, let's wait a minute. We're going to eat a chocolate. Just don't worry. Come to the superego and say, look, superego, dark chocolate actually have a lot of antioxidant. Actually, it's good for your heart. Actually, it make you lose weight. And Dr. Ali is going to walk for 2 miles today, and he going to go to the gym. And then he make a defense mechanism called rationalization. Rationalization, so the ego's job, and this is very important to understand. So if you don't, please let me know. So the ego's job is to mediate between the superego and the id, so it solves that anxiety. So if you have a good ego, then you are immune to have anxiety. Why? Because the ego always come up with a solution to prevent you from having anxiety. And this is what happened to most human being in normal situation. For example, here, as أحلام used to say, اللي ما يطول العنب حامضا عنه يقول. This fox when I eat the grape, but they are too far away. So he said, this grape are fable, and is an example of what you call rationalization. So he is using a defense mechanism called rationalization. So he said the grape is very sour, and you know, he cannot imagine that he cannot reach them, because if he say I cannot reach them, then he will be very anxious. So the ego come with a solution that, you know, don't worry about this grape, they are very sour, they are not good for you. So this is what you call rationalization, and it is a defense mechanism. Let's take our first case today. I like to do cases a lot. So our first case is a patient of mine, actual patient. We just changed the name and the situation so to fit our presentation. So Dinah came to my office with her husband. Dinah is a 59 and a half. She's been 59 and a half for the last 10 years. She never changed, thanks God. Most women stay 59 for many, many years. So she came with a severe nervous breakdown. She was walking in the mall with her husband, and somebody told her, Ya Khala. And when she heard this word, Ya Khala, she became very, very anxious, and her husband brought her to my clinic. He said that she's having a nervous breakdown. Apparently, after she heard this word, she felt very, very anxious, and she was not herself, and she couldn't sleep, and she couldn't eat. And so, as you know me, I have to work like a police detective. I need to know where this is coming from, and you know, this is not normal. If somebody told you, Khala, to have a nervous breakdown or a panic attack or anxiety. So what we study in Dinah is really that always go to the childhood. Always, when you have any trouble, always go to the childhood. Ya Khala means old lady. Yani, somebody in the mall, if I tell you Ya Khala, means that you are like my aunt, or you are much older than me. So her psyche could not tolerate that she is an old lady. She still feel in herself that she is a young lady. So always when you have this, you always go to the childhood. Is that clear? You go to the childhood, and a very interesting childhood with Dinah, very, very interesting. Dinah was born when her father was 70 years old, and she really did not have any bonding with her father, because her father really abused her, and he didn't like her, and she was an accident. And you know, she was not treated well, not cared for as a child. She told me that when they used to eat, they gave her the rest of the food to eat, she and her mother. So she had a miserable childhood. And this is where we found out, we connect the dot here. The miserable childhood means caused Dinah to have very, very poor self-esteem. Remember, all the woman's self-esteem is related to her father's, how is he treating her. So when she became a little bit younger, she was 18 years old, and apparently she was gorgeous, very attractive young lady. So a guy who is very, very rich and like a princess came and married her. And he came on a white horse, like we see in the novels, with the pink hair, and he married her, and he treated her like a queen, really. And she had very good life with him. She had many kids. All of them are successful. Her husband was very, very wealthy. So she has all the Bentley and the Mercedes and the, Gucci's, all of the things that she wants. And she had her own business, and she was very, very successful. You look at her and everybody envy her. She is like, in the society, she is very well known and everybody respect her. The very high society role. But she told me, despite all of that, inside her, she is like this. She is nothing. She feels that she is nothing. Why? She always come to her mind that how did her father treated her? Her father was very critical of her. She was haunted by this memory of her traumatic upbringing. Despite all of the wealth, all of the love she had from her husband, all of the good things is happening to her, all of her successful children, everything is great, but her self-esteem is this much. That's been like an ant, nothing. So conflict in early life, if it's not resolved, it keep coming to your brain. So what Dinah was needed is really somebody to remove this haunted memory from her brain, but she couldn't. She never thought any help, and she kept pushing that painful memory outside of her awareness. But when this lady told her, Ya Khala means ya old lady, she apparently brought her anxiety and nervousness. All of this bad memory came to the surface. And remember, because her poor relation with her father, remember, much of a woman's self-esteem is the result of her father treated her. So always when you have girls, always treat them like a queen. Why? Because this is how you're going to build their self-esteem. If you criticize them, they're going to have low self-esteem, no ego, and they're going to fail in life. They're going to have a lot of miserability. So parent is the one that will build our self-esteem. Parent who are building our soul foundation. Now, despite all of the good things that happened to Dinah, because of that miserable childhood, her self-esteem is nothing. Despite all of this wealth, all of this Bentley, all of this Mercedes, all of these Gucci's, all of this, is still, she is nothing because of the father did not treat her like this lady here. So we have two kinds of people. Your ego either develop, and when your developed ego is good, and you have good ego, then you are immune to criticism. You don't care whether people said you are bad or good, it's the same. You are very confident, you have good self-esteem, and you're gonna succeed in life. Now, people like Dinah who had poor self-esteem and poor ego, they kept always looking for validation from others. So Dinah, the most important things for her, she told me, is I only think about how people think of me. The only problem I have is people. I care way too much about how people talk about me. She needs validation from everybody around her. She had to wear certain dress, certain car, certain things just to get admiration from people. When you see somebody like this, that means they have very, very weak ego. We call that externally oriented person. So if I have a weak ego, I will send you a message for every one of you. Oh, please let me know. Did I do a good job? Am I a good person? Am I a good teacher? Because I don't have any self-confidence. I seek your validation. This is very bad. So this is what happened to Dinah because her father treated her very bad. She couldn't tolerate any criticism. Criticism is no way for any way that she can handle. So when that lady told her, Ya Khala, that's not a criticism, that's severe criticism. That's mean you are old. Ya Khala means that you are old. And Dinah still in her brain, still want to go back and feel like she's the 18 years old or 25 years old, the attractive young lady who is admired by everybody around her. So that Ya Khala is really what destroyed her self-esteem and brought all of the bad memory for her because she had very weak ego. So that's why when we have a good ego, this is what happened to Dinah. This blue circle here is the limbic system where we carry all of these memory from childhood, all of the painful memory. And that memory keep coming to the conscious level all the time when it comes to the conscious level. But if we have a good ego, a strong ego, it will always suppress it down. I don't care about my childhood. I'm done. I'm strong. You know, even if I have miserability in my childhood, but I'm strong. I have a good ego. But like Dinah, who had very weak ego, she couldn't handle this criticism because her ego is very weak. So these memories who comes to the conscious level really destroy her and make her have severe anxiety and severe conflict. So this conflict, which happened in early childhood, she was unable to deal with, and she had all of this miserability in her life. So what we found out in Dinah that she had very fragile ego due to her poor relation with her father. So look, where is the problem with Dinah? It's not her anxiety, it's not her Ya Khala, it's the poor relation with the father. So one of the way to deal with Dinah here is really to go back to that childhood and reflect on it and teach her how to get over that father's criticism. And this is what we did with her. We gave her like 6 or 5 sessions. She wrote a letter to her father. She was able to communicate unconsciously with him. We show her the way how to deal with the self-esteem, and she is doing very well. I still see her frequently, and she is doing very, very well. So, but you don't give her just antidepressant. No, you just need to go back and see where is the problem, where is it hurt, and because Dinah was unable to use any defense mechanism. Remember, defense mechanism, and it's an ego defense mechanism, and Dinah could not use them because she has very weak ego. So this is what happened. She had very, very strong amygdala, carrying all of this bad memory from childhood, which caused her to be very sensitive, very angry, unable to relax, unable to calm down because of that. So the way to treat her is we do, like we said, psychotherapy, and we give her medication like SSRIs. And this is, I wrote you the SSRIs group. They usually increase serotonin in the brain. When you have increased serotonin, serotonin inhibits the amygdala. We said the amygdala is our troublemaker. So serotonin inhibits the amygdala and improve the frontal lobe. So always we said in depression, our frontal lobe cannot control the amygdala. So when we take antidepressant, it increases serotonin. When we increase serotonin, it will empower the frontal lobe to control the amygdala. At the same time, it will decrease the activity in the amygdala. So you strengthen the frontal lobe and weaken the amygdala, and you get rid of the anxiety. So this is how serotonin will suppress the amygdala, inhibit the amygdala, improve the frontal lobe, and Dinah will be like this later on after we switch off this anxiety with the help of therapy and medication. Remember, therapy alone might not work. You need therapy and medication. So that's why always learn not to criticize anybody. Learn this, because criticism means you hate me. When you criticize me, means you hate me unconsciously. Why? Because in our brain, always remember, when you are in love with someone, you don't see anything wrong with him. Why? Because you are in love with him. When you are in love with someone, you cannot see anything wrong with him. When you criticize him, that's mean you see something wrong with him, and that's not good. Especially if you have a wife or a husband who had weak ego, don't ever criticize him. Let's see, for example, I come one day, this didn't happen, but just for example, you came one day and your wife had cooked some kapsa. I hope you understand what is the meaning of kapsa in Arabic. So the kapsa was not really tasting that good, so something wrong. Maybe the wife was busy doing other thing. Maybe she had some anxiety. She didn't do well in this kapsa this time. So never criticize the kapsa at all, because criticism means the amygdala is able to see something wrong with your wife. Always think of your wife as a perfect lady, that she doesn't do any mistake, especially if she had weak self-esteem or weak ego, because the criticism always destroys her. So always blame the chicken, means tell her, you know, your kapsa is always the best kapsa in the world. You know, you cook the most outstanding kapsa in the whole world. This time it's still very good, but I think it's the chicken that we bought last week from Benda, which was frozen, and I think this kind of chicken is bad and will never bring this chicken again. So always blame the chicken. Don't blame the wife, because if you blame the wife and she have low self-esteem, she interprets this criticism as she is bad, she is a failure, and you're gonna have to deal with her anxiety later on. So amygdala, remember, especially in people who had low self-esteem, amygdala cannot tolerate criticism. Never criticize anyone. If you want to criticize somebody, do it very gently, in a very good way, without destroying that person. You know, I remember when I used to apply for residency in the US, they always send me the same letter. Dr. Ali, we like your credential. You are one of the best. We like everything about you. And then, unfortunately, we cannot hire you this time. So they always write a first page, how good you are. And the second page, they said, we're not going to have you. So they learn how to do it naturally, because they don't want to criticize you. And never say ya khala to anyone. This is too. So remember that we always have painful childhood memory. This is very common cause of anxiety. When you see a patient and they have all of this painful memory, and all of us have very bad childhood and painful memory from childhood, all of us. So we try to use defense mechanism to bury this painful memory. This defense mechanism most likely called repression. Repression is your ability to bury these bad memories from the awareness, because if they come to the awareness level in the frontal lobe, they're going to destroy your life. So we always like to keep them buried in the unconscious mind. So always try to see what defense mechanism the patient is using and try to not cause the patient to have panic attacks. Do we have time to go to the next case? We'll stop here. So the next case is very, very interesting case. So we're going to talk about it in the next hours at 3 o'clock, inshallah. So it's now, let me see, it's 8 minutes till 2. So we'll meet at 3 o'clock, inshallah. Question? Do we have any question? Where is the question? Chat. Yes, she can have good relation with her dad and have low self-esteem. And not everybody who had bad relation with her dad will have a low self-esteem. Remember, this is like if you smoke. If you smoke, you might have lung cancer. But even if you don't smoke, you might have lung cancer. And you might smoke and never had lung cancer. It just, if you have this smoking, you can increase your risk of having lung cancer. So if you have poor relation with your dad, you have more ability to have poor self-esteem. Is that clear? So this is in psychiatry. It's not 1 + 1 = 2. If you do this, you increase your odds of having that. If someone have constant panic attack during exam, okay. So are they recommended? Yes, there is a lot of medication we can do for that, for panic attack during exam. But this is a different subject. We're not going to talk about medication because we don't have time. Remember, you gave me 1 hour to do a subject for 3 hours. So I cannot do all of this in 1 hour. Palpitation and fatigue, sweating lasts for a month without stop. No, they wax and wane. So they increase a little bit and they subside and they increase. They come in episode. So they come and go back. Can you please repeat defense mechanism? Last slide. We'll do it in the next session, inshallah. Dinah's case is both GAD and panic attack. When did you treat someone with GAD? We need always to treat GAD with SSRIs and CBT, both of them. Sometimes we use CBT, but most likely we're going to have to use both SSRIs and CBT. So we need to do both, most of the cases. Improving self-esteem is really is very easy. You have to do what we call psychotherapy. This is the role of psychotherapy, to teach the patient how to understand their personality, how to understand their strength, how to not rely on other for validation. So this is a psychotherapy technique. Yes, amygdala is the one who doesn't like the uncertainty. Boys also same like girls. But boys a little bit different, so we'll talk about it in the next session. Mom also, but see, the problem is mom always good. I've never seen a bad mother. Always mom deal with her kids very, very gently and very nicely. Always men who are the trouble, like we are the trouble, not the woman. Women always nice. I've hardly ever seen any lady who hate her kids or who criticize her kids, because you are part of your mom. So mom will not be able to criticize you. Even if she tried, she will not be able to do that. More questions? Thank you. We'll see you around 3 o'clock, okay?